The best of Money Matters. Right Business.
Welcome to The Right Business, where we dive deep into the stories of trailblazers who dare to disrupt the status quo, find the gap in the market to find the right business. Hello, I'm Hongbin, Jeong. Now, healthcare innovation is rapidly changing the way we approach patient care. And one of the areas seeing tremendous growth is the use of artificial intelligence to assist in clinical decision-making. And despite the potential of AI, many healthcare solutions have struggled to achieve wide adoption due to challenges in securing funding, gaining clinical trust, and integrating seamlessly into existing workflows. So this is where TIIM Healthcare steps in. The company is using AI to revolutionize healthcare triage by helping clinicians quickly identify high-risk patients, particularly those presenting with chest pain. So to find out more, joining me today is Professor Marcus Ong, who's a senior consultant and clinical scientist at the Department of Emergency Medicine at the Singapore General Hospital, as well as Dr. Pauline Erica Tay, who is the director at the National Health Innovation Center of Singapore. Hello, both. Thank you so much for joining me today.
Hi, good afternoon.
Hello. Okay, let's begin with Professor Ong here. I mean, Professor, you've been working at the front line of emergency medicine for years, and your clinical experience gives you a clear view of where the system works and where it doesn't. So, Professor Ong, what significant gap did you identify in the current triage or emergency care process that made you feel something had to change?
Well, Hongbin, I work frontline in the emergency department. So I won't say it's a gap, but it's always challenging to do triage in the fast-paced and busy environment of the emergency department. So medical triage is a process where we actually screen and identify patients according to their risk factors. And obviously, high-risk patients would need to be attended to quickly and urgently, whereas more stable and lower-risk patients can actually have a slower pace, and we can actually attend to the more serious cases first. So chest pain is a good example. This is one of the most common conditions that presents at the emergency department. And chest pain is a wide spectrum. Some patients may be having a serious heart attack, which needs immediate intervention to save their life. But actually, a lot of patients are coming in with very non-specific symptoms, chest pain, breathlessness, that could be related to a less urgent or emergent cause, like heartburn or even anxiety. And so I developed aiTriage from my research as an objective tool that can leverage on artificial intelligence and risk prediction scoring to be able to give real-time clinical decision support for frontline clinicians so that we can better triage patients.
Okay, so Professor, let's talk more about the development of aiTriage here. Could you walk us through how the solution works and why it's such a game changer?
Right, so aiTriage basically is a device that is portable, can be used at the bedside, and helps the frontline clinician to make better clinical decisions. So traditionally, triage is performed by a nurse at the emergency department, who will use a combination of what we call the history, examination, and vital signs. In other words, asking about the patient's symptoms, checking your blood pressure, some of the usual vital signs, and then we would assign them with a risk score, so based on what we call the patient acuity category scale that is used across Singapore. PAC 1 being the most severe, where patients need immediate resuscitation, down to 2, 3, and 4, which is the least severe and non-emergency. But this process relies very heavily on the clinical judgment and experience of the nurse. And so the quality of the triage may vary between people, and it's always difficult with symptoms. For example, for me, my chest pain may be the worst that I've experienced, 10 upon 10.
Right.
But someone who is more stoic may say that, I'm just having something mild, 2 upon 10. So in contrast, aiTriage uses something that we call heart rate variability analysis. And this is something that we've been working in my lab for the last 20 years. And think of it, the analogy I use is in traditional Chinese medicine, we actually can get a lot of information from the person's pulse because there's a beat-to-beat variation. And the problem is that it's not easy for the human to pick up these subtle changes. But using signal processing and advanced techniques with the electrocardiogram, we can actually pick up these changes in the heart rate variability. And then we combine this with the patient's medical history like age, risk factors, and other vital signs to compute an objective risk score. And this can be done in 5 minutes. It doesn't require any blood test. So in other words, it is non-invasive and gives you an objective risk of what we call major adverse cardiac events. In other words, something bad happening to you from your chest pain within the next 30 days. And so then this is fed back to the clinician as a clinical decision support.
That's very interesting. Well, let's bring you into the conversation as well, Dr. Tay. What about this solution convinced you that it was the right fit for NHIC to back? And how did NHIC help the team get aiTriage trial ready, especially when it came to, navigating regulatory requirements, clinical trials, or local adoption?
Thanks, Hongbin. So the NHIC, as listeners don't know, we work with all the public healthcare institutions to innovate, develop, commercialize, and implement technologies into clinical practice. So in choosing all our technologies that we want to back, they definitely have to meet a clear unmet clinical need. There must be a realistic pathway to market so that it can achieve some level of financial sustainability, but more importantly, that the new technology that we support would bring real patient care that is accessible and affordable, right? So definitely Prof. Marcus Ong's technologies and what he has developed checked all the boxes, right? It clearly addressed a clinical need. I mean, as mentioned just now, it is challenging, when people come and say they have chest pain, there are different variety of whether or not it really is a severe disorder or that, it's fairly subjective. And clinicians up until this point, or nurses, in fact, don't really have anything to help them, to support them in looking at the patients and deciding which one has to be treated immediately and which one you can actually discharge. This kind of also leads to, lots of people go to the emergency departments and they end up waiting very long because there are a lot of patients, right, that you have to treat. Now, if there was aiTriage that could help to sort of risk stratify the patients at the emergency department, then as Prof. Marcus mentioned, they can treat the ones that really require the assistance immediately. And for those who, it's really just they feel chest pain, but it's maybe not such a severe disorder and they can be treated at the community level. So certainly it met a clinical unmet need, and certainly there was a pathway that we could help with implementation and as well as bring it to market. So we supported Prof. Marcus's project through a grant. So it's a developmental grant called Innovation to Develop. And that helped them to develop like a working prototype whilst they were doing the clinical trials. And just most recently in 2023, they got a grant called the Innovation to Adopt grant. So this helps them to have it implemented across more than one hospital cluster in Singapore. Simultaneously, they've also been linked up with a partner called the Digital Health Accelerator to help them to integrate the system into, how it is with digital technologies, you have to have it integrated into like the electronic medical record. Yeah, so all of that, right, with making sure that there's proper privacy, cybersecurity, readiness for deployment across the healthcare clusters. Yep.
Well then, Professor Ong, what was your approach to ensuring aiTriage could integrate smoothly into, fast-paced clinical settings? Were there any big lessons from those early trials?
Well, as a clinician myself, I think any AI solution has to be simple to deploy, easy to use, and easy to understand. And most importantly, it should uphold patient safety and, be accurate. And so we took a very deliberate approach in developing aiTriage, starting with research in our lab, making sure the technology was robust, filing our intellectual property, and then starting with observational studies in the emergency department to understand the workflows and making sure that whatever solution that we produce or propose would fit into the clinician's workflow and help them rather than, be a burden or make things more difficult for them. And I want to acknowledge the support that NHIC has given to us at each of these stages. They help support us to do a large clinical study in 3 hospitals in Singapore, SGH, Changi General Hospital, Sengkang. And from there, we got valuable information that help us to actually refine the algorithm and develop the clinical prototype. And we just finished a large randomized control trial at Singapore General Hospital with 500 patients that presented with chest pain. And we were able to show that it reduced the admission rate by about 10% and also cut down the time to discharge patients that were low risk. And so with all these trials, I think we've been able to show the value of aiTriage, and we are able to now move to the next stage where we're looking at expanding to other settings, other use case, and even other countries.
That's amazing. Well, Dr. Tay, aside from aiTriage here, what other products do you offer that aim to improve the clinical workflow or patient care in emergency or acute settings? And how do these additional solutions complement aiTriage and fit into a broader ecosystem of healthcare technologies?
Okay, Hongbin, I don't really have a couple of examples for the emergency department per se, but certainly in improving clinical workflow, as what Prof. Marcus Ong mentioned just now, it is very important, right? So especially using AI, as a lot of people would be asking now, how do some of this bring in some of these like AI and algorithms help with, tightening the workflow, accelerating the process and enabling a lot of the care staff to manage their day-to-day operations. So we did have it's a startup now. We supported a technology, or rather it's just computerized adaptive tests, or CATs for short, right, to manage treatment in vision impairment. So this can include diabetic eye disease, glaucoma, and myopia. So traditionally, all this, as what Prof. Marcus mentioned just now, a lot of this feedback from patients had always been pen and paper, and it's very laborious, right? So like if, you had to pass a survey form to patients, and as they take their medication, they fill it up, and then they get back to the doctors. It takes a long time for doctors and nurses to diagnose or to prognose whether or not the medication that they are receiving is helping them. Now, if you have, like a computerized system where patients can easily enter the feedback, whether or not they can see clearly, is it really working, this actually helps accelerate or hasten the workflow, makes it easier for both the patients as well as the care staff. So this particular technology is now a startup company. It's called Prompt Insight. And, it really reduces the lengthy traditional surveys, cutting time down to 70%. So people can be treated faster, more efficiently, more accurately as well. Yeah.
Okay. Well, Professor Ong here, what kind of feedback have you also received from clinicians during the trials at SGH and NUH? And have you seen aiTriage shift how decisions are made in the emergency department?
Yeah, so we've had very positive feedback, and our clinicians have been very supportive of the clinical implementation of aiTriage. I just had a discussion with my cardiology colleagues actually just this morning, and they see the value of this in being able to speed up decision-making and especially identify low-risk patients that are safe for discharge. And this will go a long way to help with the kind of overcrowding problems and long waiting times that we have in many of our emergency departments. One interesting feedback from our nurses was that having this clinical decision support was something like having an AI expert at your side, as you are triaging the patient. And so then the technology emphasizes on something that we call interpretable AI. In other words, it doesn't just give you the AI recommendation, but behind we actually open the hood in that sense to show the clinician what are the risk factors that are driving the prediction, so that the clinician can also understand what is actually classifying this patient as a high risk versus a low risk patient. And so the nurses really appreciate this kind of backup and giving them some objective evidence in which to make their triage decision.
Right. Very interesting indeed. Well, thank you so much, both Dr. Tay and Professor Ong, for joining me today.
Thank you so much, Hongbin, for the opportunity.
Thank you. That was Professor Marcus Ong, who's a senior consultant and clinician scientist at the Department of Emergency Medicine at the Singapore General Hospital, and Dr. Pauline Erica Tay, who's a director at the National Health Innovation Center of Singapore. This has been The Right Business with me, Hongbin Jeong.
To listen to more great interviews, download our podcasts at audio.sg or download the audio app. That's AWEDIO, audio at the App Store and Google Play.